Welcome back to another NCLEX question of the day. We are covering a life-threatening gastrointestinal emergency, acute esophageal variceal bleeding. This condition is a major complication of alcoholic cirrhosis and can lead to severe hemorrhagic shock if not managed immediately. Understanding how to prioritize interventions in this scenario is essential for the NCLEX and real-world nursing practice. Let's begin. A 55-year-old male with a history of alcoholic cirrhosis is brought to the emergency department after vomiting large amounts of bright red blood. He reports weakness, dizziness, and abdominal swelling. The nurse notes that the patient appears pale and diaphoretic with a distended abdomen and scleral icterus. His assessment findings are as follows. Vital signs: blood pressure, 86/52. Heart rate, 132 beats per minute. Respiratory rate, 24 breaths per minute. Temperature, 37.5 degrees Celsius or 99.5 degrees Fahrenheit. Oxygen saturation, 95% on room air. Physical exam. Capillary refill greater than 4 seconds. Cold extremities. Ascites with a positive fluid wave. Hematochezia noted on rectal exam. Laboratory results. Hemoglobin, 6.4. Hematocrit, 19%. Platelets, 78,000. INR, 2.5. Blood urea nitrogen or BUN, 35. Creatinine, 1.9. Total bilirubin, 6.2. Albumin, 2.1. The nurse suspects acute variceal hemorrhage due to esophageal varices secondary to cirrhosis. Which of the following interventions should the nurse implement first? Option A. Administer intravenous octreotide to reduce portal hypertension. Option B. Initiate intravenous fluid resuscitation with lactated Ringer's solution. Option C. Prepare for emergent endoscopy with possible band ligation. Option D. Administer intravenous vitamin K and fresh frozen plasma to correct coagulopathy. Take a moment to think about your answer. The correct answer is option B. Let's break it down. Option B is correct because this patient is in severe hemorrhagic shock due to massive upper gastrointestinal bleeding. A blood pressure of 86/52 and a heart rate of 132 beats per minute are classic signs of hypovolemic shock. Immediate volume replacement with lactated Ringer's or normal saline is necessary to restore intravascular volume and improve perfusion. If fluid resuscitation is delayed, organ hypoperfusion will lead to multi-organ failure and death. Key NCLEX rule. In massive hemorrhage, restore circulating volume before addressing the underlying cause. Option A is incorrect because while octreotide reduces portal hypertension and decreases blood flow to varices, it does not replace lost blood volume. Giving octreotide before stabilizing blood pressure will not prevent shock. Octreotide should be given after fluid resuscitation. Option C is incorrect because while endoscopy is required to confirm and treat variceal bleeding, it cannot be performed on an unstable patient. If the patient is severely hypotensive, sedation for endoscopy could cause cardiovascular collapse. Endoscopy is performed after resuscitation, when blood pressure is stable. Option D is incorrect because while the patient has coagulopathy due to liver failure, correcting clotting does not replace lost blood volume. If perfusion is not restored first, the patient will die from shock before coagulopathy can be corrected. After volume resuscitation and bleeding control, fresh frozen plasma and vitamin K are given. Key takeaways. Intravenous fluid resuscitation with lactated Ringer's or normal saline is the first-line intervention for hemorrhagic shock. Octreotide is essential, but should be given after blood pressure is stabilized. Endoscopy is necessary, but should only be performed after resuscitation. Fresh frozen plasma and vitamin K correct clotting abnormalities, but do not replace lost blood volume. Did you get the answer right? Let us know in the comments. If you want expert guidance on test-taking strategies, book our crash course for a structured approach to answering NCLEX questions with confidence. Reserve your spot now at nclexsage.com. Share this with a fellow nursing student and subscribe for more test-taking strategies and exam tips. Thank you for watching, and see you in the next video.